Hi everyone, welcome back to the Complete Health Australia podcast. My name is Teshan. I'm here with the lovely geriatrician, Dr. Nilakshi Weerasinghe. How are you?
Good, thank you, Teshan. Thank you for inviting.
No problem. Thank you so much for coming. Do you want to tell everyone a little bit about yourself and your experience?
Yes, so I'm a geriatrician working in Sydney, currently working at Bankstown and Concord hospitals, and was working at Prince of Wales Hospital before that. And also I see patients in my rooms in Oakham Hills, Rouse Hill, and in the surrounding areas.
Perfect.
Yeah.
All right, so what we're going to talk about today is we're going to talk about the falls in the elderly. So look, the first question that I have is how common are the falls in elderly?
Yeah, Teshan, so actually falls are very common in the elderly. So about 30% of our patients about the age of 65 have falls every year, and about half of them are actually recurrent fallers.
Right.
And it's quite concerning because these falls can lead to very serious injuries. Even as common as 1 in 10 of them can lead to a very significant injury, like head injury, intracranial bleed, hip fractures. So this can, sometimes lead to mortality. So losing independence in the elderly, and they can end up being placed in an aged care facility following an admission with a significant injury.
Yeah. Is there any reasons for the falls in the elderly?
Yeah, so when you talk about falls in the elderly, the reasons are actually multifactorial. So it's not just one reason, there's a combination of factors.
Right.
So there are patient factors, and also there are environmental factors. And some of these factors are modifiable and some are non-modifiable.
Yeah.
Would you like me to give some examples?
Absolutely, yeah. Tell me some examples, yeah.
So when it comes to patient factors, there are a lot of problems with our patients. They have multiple medical issues to start with. So a lot of the time they're on multiple medications. Some of the side effects of these medications can increase the falls risk.
Yeah.
And then our elderly patients have sensory impairments, like their vision may be impaired, their hearing may be impaired. So this also increases their risk of having falls. And also, as people get older, they develop a lot of neuromuscular degenerative diseases like arthritis and dementias and others like Parkinson's disease. And with these conditions, again, they increase the risk of falls because they can't actually move very flexibly like the young people. Yeah. So those are some of patient factors. And then there are environmental factors. For example, very simple things like if they're living in a house with clutter and not enough space to move around.
Yeah, that makes sense.
Yeah, and if there's very irregular surfaces on the ground, we don't notice them as younger people. Even like a carpet where the edge may be rolled can lead to a fall in the elderly because a lot of the time they can't lift their feet adequately to clear the ground. They tend to drag their feet a bit, so that can lead to tripping and falling. So as I said, some of them are modifiable and some of them are not. It is very important that we look into all these factors.
Okay, so what kind of steps do you think we can take to reduce?
Yeah, so that's right. So firstly, looking at these modifiable factors like patient factors, as doctors, it's quite important that we review what medical conditions they have and what medications that they're on. So sometimes some conditions are not correctly diagnosed and as a result they're not being properly treated because for example, if people are not on the right medications for Parkinson's disease, they can be very stiff and that can lead to falls.
Right, okay, yeah.
And then again, if they are on too many medications or unnecessary medications as a result of the side effects from these medications, they can feel a bit dizzy or lightheaded, or their blood pressure can fall too low. Yeah. And these can lead to increased falls as well. Okay. So it's important to get them off medications that are not necessary or which are harmful to them. and then we need to get the involvement of the family, the carers of these patients,
Yep,
and
for
also other allied health teams like a physiotherapist and occupational therapist to help with, for example, modifying the home environment
Yep.
to remove the clutter, and have some safety equipment like rails or ramps to make it easier for these elderly patients to move around. So we need to have that sort of a holistic approach and get the contribution of all parties involved to get good outcomes for our
I
patients.
completely agree. Well, thank you very much for talking about the
You're
falls in
welcome.
the elderly.
Pleasure.
Guys, if you have any questions for Dr. Nilakshi Weerasinghe or for any of our other specialists, please email us at admin@completehealthaustralia.com.au. Follow us on our socials. So we're on Facebook, Instagram and LinkedIn, and just search Complete Health Australia. Thanks so much, guys. See you next time.